Is your neck causing your dizziness is the subject of this video. In this video, we're going to find out why so many people have dizziness, most likely, what's the most common cause of dizziness, and some of the exercises that can help you with the dizziness issue. So first of all, you got to understand that unfortunately, because of our lifestyle of being behind computers for so long and so much, that we have lost the ability of our neck to be moving like it should. So we're having restriction in the movement in our neck itself. Each joint, there are receptors that give a lot of communication to the brain. The positioning of the head over the neck relies heavily on your neck mobility. And the most common kind of dizziness is cervicogenic, meaning neck generating. So with more restriction in your neck and restriction of the head over the neck comes a lot of good reasons why dizziness happens. So as you know, a lot of times when people have dizziness, they go to a doctor to get their ears checked because they're thinking it's inner ear, and then it's clear. In other words, there is no infection, nothing's happening there, and yet the dizziness persists. The reality is, as we move our neck less and less, we are losing our ability of those semicircular canals, those little canals inside of our ears that look or they act like levels to give information to the brain for different movements, flexion, extension, side or diagonal movements. All of those levels give input to the brain. When they're sitting in your ear, but they're not, the head is not moving to give that information, to utilize those levels, then the brain is not receiving proper information in a timely manner. So this means dizziness, means you're gonna move, whoa, I got dizzy, and then you move on. Now bear in mind there are conditions like POTS, postural orthostatic tachycardia syndrome, that dizziness comes with it. We're not talking about this. We're talking about cervicogenic, which is the most common cause of dizziness. So what do we need to do when it comes to cervicogenic dizziness? What we want to do is we want to eliminate or modify the things that actually feed the problem. That means usage of our devices, how often we use, how much we use. That's a whole different video on that. I don't want to digress here, but I want to point out that it is important to look into those. The size of your keyboard plays a role. The size of your monitor or the fonts on your monitor and how close or far the monitor is, if it's in the right eye level position or not. These are all going to play a role as to how this head over the neck moves, and that leads to potential for cervicogenic dizziness. Now, the other thing that I want to bring to your attention is that by just concentrating on the neck and not look at your whole posture, you're not doing yourself a service. Your neck position doesn't just randomly change. While lifestyle can play a role, and it plays a big role, it also has to respond to the rest of your body. And the reason for that is because if that modification does not happen, you'd be miserable. So when the neck goes forward, when you are slouching and that forward neck goes hand in hand with it, now we're talking about positioning of the neck and modification of that position based on everything else. So when it comes to dizziness, cervicogenic dizziness in my practice, I always make sure I cover certain things. That means head movement over the neck movement over the body, and the role of my shoulder blade stabilizers on the neck positioning. I always work on breathing and making sure that biological breathing is in place. So I'm going to go over all of these with you. And so if you have not subscribed to my channel, this is a great opportunity to do so. So every time I post a video, you get notified. So make sure you turn on that notification bell on and put down your comments and questions, and I'll make sure that I answer them. So first of all, we're going to start with breathing. Breathing biologically is what we've all done as babies and is what we know by studying human babies. We know that we are to breathe in and out through our noses, and it's the best practice to do it on the floor, so face up, before you start sitting and standing and practicing to breathe biologically. Unlike what people do when they want to take a deep breath in, which is they take a deep breath in and the chest comes out towards the camera. When you breathe in, your diaphragm, your abdominal diaphragm drops down, and it actually pushes your floating ribs outward. So if you place your hands on the sides of your rib cage and you breathe in through your nose and you feel the size of your rib cage going out, you're on the right track. Now you can go down and place your hands on your waist and just above your pelvis, with your fingers being right in front of your abdomen and with your thumbs in the back. So if you can breathe in through your nose and you feel these gently pressing out, you're doing a great job doing biological breathing. Biological breathing is like inner tubing, which doesn't stop you from slouching, but it puts you in a better place. So it's more going in the right direction, which is what we want to do. The next exercise that I want to bring to your attention is the importance of the head movement over neck movement. Most people use the back of their head muscles to move the neck. So when I say glide your neck back, they look up and shove it back, as an example. So the neck muscles are very different than the head muscles, or the ones that are in charge of moving of your head over your neck. So what you want to do is place the tip of your tongue to the back of your teeth. Don't push it, just place it there. Keep the middle of your tongue to the roof of your mouth and act like you're about to swallow. I've noticed my patients do a lot better with their cueing when they do those things. And then you glide your neck back. You don't want to tuck your chin and shove it back, and you certainly don't want to look up. The next exercise that I like related to the neck is what we all did at age 6 weeks to 3 months. These are all developmental exercises, the exercises that we have learned by studying human babies. These are the same things babies have done to go from the stage where they could barely hold their head up to become running toddlers. So this is pertinent to what we're doing with neck stability and neck proper movement. So for this, I'm going to lay down on the stomach. So this is what we did when we did tummy time. So you're going to be laying down on your stomach. Put the crease of your elbows to your ear level. Is this better? Crease of your elbow to line up with your ear level. You're not using clenching your butt, and you're not using your lower back muscles. You go on your forehead, press down on the inside of your elbows, send the shoulder blade south. So slightly moving that shoulder blade on your back, just like that. Scrape your nose on the floor, get the tip off, go another inch, and glide your neck back, and you hold. Once you feel more comfortable, the whole time, by the way, your shoulder blade's going south, then you are going to turn your head to the right and to the left without dropping it. This will activate the back of your neck muscles, which is so important. The next thing that is very, very helpful is what you did at about late stages of 3 months. So you're gonna find this little bone on the pinky side of your wrist. So find it, place it on the floor and right under your shoulders. So the fingers are not beyond your shoulder, the fingers are right under your shoulders. The line of movement is from the upper trap to the point of the elbow, and from the elbows to the pisiform, that little bone on the pinky side of your wrist. So again, upper trap to the point of the elbow. When I send that movement there, it moves my shoulder blade slightly down my back from my elbows to the pisiform, to that bone. It's as if I'm trying to do this movement. Scrape the nose, get the tip off, another inch, glide the neck up, and keep pressing and get your chest bone off the floor and hold. This is allowing the muscles in the back of your neck, your shoulder blade, and the top portion of your shoulders work together, which is so, so important. Now, we want to not forget about shoulder blade stabilizers, because when the shoulder blade stabilizers don't do a good job, the shoulders roll forward, which means the neck is going to go forward, because that's an adaptation and modification. And if that becomes your posture, now we've got a problem. So the one exercise I absolutely love, and it could be challenging, is what you did when you were 5 months old. So you're going to be laying down on your back. By the way, for all of these exercises, you're going to breathe biologically, because that's how we're supposed to be breathing. So you're going to be laying down on your back, legs up in the air. And so I'm going to come towards the camera. And as I turn, the whole side of me moves together. So that means my top, my right upper quadrant and lower quadrant are going to be moving towards the camera at the same time. As I start rotating, I'm going to press the back of the top portion of my arm into the ground, which activates my armpit muscle, or my serratus anterior muscle, which lifts me up, as you can see that gap. Now, when it's time to go back, I'm going to, at the beginning, ask you to press down, like as if you're elbowing the ground, only not with the elbow, but the back portion of your arm, and you're going to rotate back as one unit, meaning your legs don't go faster than the rest of you. So this is allowing the activation of my whole trunk to move together, so that's stability of the trunk. And one of the most involved muscles of your shoulder blade, which is your serratus anterior, is getting activated and practiced on. When we have to slouch forward, that muscle is really not doing a good job, or having a chance to do a good job. So once again, when it comes to dizziness, we don't want to always think it's inner ear. It could be other medical things we want to rule out. But going back to the most common cause of dizziness, which is cervicogenic dizziness, we don't want to just think about the neck or just the head, but that whole region. If you have not subscribed by now, make sure you subscribe to my channel. Make sure you put down your comments and any questions you may have, and I'll do more videos on that. Until next time, take care.